Hi everyone. Today we're going to be talking about the medication lisinopril and everything you should need to know about it and how it applies to our patient.
Our patient is a 78-year-old female that was admitted 2 days ago to the medical surgical unit with a diagnosis of acute exacerbation of heart failure. She has a history of 2 myocardial infarctions in the last 4 years, atrial fibrillation, and long-standing hypertension.
The doctor prescribed lisinopril for the treatment of hypertension resulting from her heart failure.
Lisinopril is classified as an angiotensin-converting enzyme inhibitor.
Some common brand names for lisinopril are Prenavil and Zestro.
To administer lisinopril, you will use oral routes such as a tablet or oral solution.
For our patient with heart failure, the dose of lisinopril she will receive is 20 milligrams once daily. A starting dose for a patient with newly diagnosed hypertension, you will want to start the medication at 10 milligrams.
If you have forgotten to take your medication, take it as soon as possible. But if you cannot remember if you already have taken your medication, do not take it because it can cause hypotension, dizziness, sleepiness, and heart palpitations.
Indications and usage: hypertension, heart failure, myocardial infarction.
The therapeutic effects of lisinopril allows blood to flow more freely, helps the heart pump blood more efficiently, and improves symptoms in patients with heart failure. The mechanism of action for lisinopril blocks the conversion of angiotensin I to the vasoconstrictor angiotensin II. ACE inhibitors prevent the degradation of bradykinin and other vasodilatory prostaglandins. ACE inhibitors also increase plasma renin levels and decrease aldosterone levels, resulting in systemic vasodilation.
Common side effects are dry cough, dizziness, headache, fatigue, and angioedema.
When taking lisinopril, it may cause hyperkalemia. You should be advised to avoid high potassium dietary intake. Do not use salt substitutes or potassium supplements while taking lisinopril, unless your doctor has told you to.
Avoid taking lisinopril if you have hyperkalemia, renal impairment, hypovolemia, or hyponatremia.
Lisinopril is contraindicated in patients with hypersensitivity, a history of angioedema, renal failure with prior lisinopril use, and bilateral renal artery stenosis.
Make sure to frequently monitor blood pressure, pulse, and potassium levels.
When it comes to allergies, refrain from taking lisinopril if you are allergic to ACE inhibitors.